which is what I'm using now, and these are why I think that I've had some success with using the right form of iodine. Is that clear? I know this is a long lecture. I mean, I could do a whole 2-hour thing just on iodine, and I wanted to just talk about the relation with iodine and breast cancer and fibrocystic breast disease, since I thought this was one of the most interesting parts of it. Is iodine deficiency responsible for breast illness, including breast cancer? Now remember, 1 in 7 women get breast cancer. The same issue is going on in men, and 1 in 3 men getting prostate cancer. Although the research isn't quite as clear for prostate cancer because it hasn't been done, but I think the same thing's going on in men. Iodine concentrates in the breast. In men, it concentrates in the prostate. Iodine is secreted from the breast. The breasts are one of the main storage sites for iodine. It's only the thyroid surpasses how much iodine's in the body. Breasts are number 2. Normal breast architecture will not develop when there's iodine deficiency present. And iodine deficiency can alter the structure and function of the breast. As I said before, the breasts are the second major storage site for iodine in the body. The thyroid gland contains more iodine. In an iodine deficient state, the breasts and the thyroid will compete for iodine, and they compete via a pump that's supposed to concentrate iodine. So in a deficient state, which I think most of us are in, the breasts and the thyroid will compete for what little iodine is present. The thyroid will win out, but at the expense of the breast. And then the thyroid will win out at the expense of the prostate. And that's not even including the rest of the tissues of the body that bind iodine. So fibrocystic breast disease. If cystic breast, so lumps in the breast, painful to touch, chronically inflamed and hardened, it's probably a precursor to breast cancer. Research is just starting to come out on that. I'm certain that it is a precursor to breast cancer, but I put a question mark because that hasn't been fully proven. Causative factors in conventional medicine are estrogens. Conventional treatment for fibrocystic breast many times is to use birth control pills to block the estrogen production down. I think that's the wrong treatment for it. Patients will be told to eliminate caffeine. What caffeine's doing is it's stimulating the body. If you're in an iodine deficient state, you don't have that iodine ability, you don't have enough iodine in the thyroid, you stimulate the body a little bit, you're worsening an iodine deficient state. So coming off caffeine does help, but it's not treating an underlying cause of it. Trans fats have been shown to worsen fibrocystic breast disease. Trans fatty acids are found in crackers, cakes, candies, and nutrient deficiencies. Vitamin E and vitamin A sometimes are prescribed to treat fibrocystic breast disease. And iodine. Iodine is the most researched element in treating fibrocystic breast disease over the last 100 years. It's extremely effective at treating fibrocystic breast disease. I have a patient, Marianne. She's 45 years old. She's an RN. She had fibrocystic breast for over 15 years. She had been seen by numerous specialists and was contemplating a mastectomy. She went to University of Michigan to be seen at their fibrocystic breast clinic, which she had seen over the last 10 years, the head of it, and she was miserable. She couldn't work out. She had trouble wearing a bra because the rubbing on it had hurt her, and she had basically come to the point when she'd seen me where she said, I'm just going to get a mastectomy. I can't stand it anymore. So I did an iodine loading test on her, and an iodine loading test is where patients take 50 milligrams of iodine, they collect 24 hours of urine, and they send a little sample of urine into a lab. And what we're looking for is how much iodine excretes out of their body from that 50 milligrams. Now, a normal loading test is greater than, they should excrete 90% if their body's saturated with iodine, so they should release 45 milligrams. However, she only excreted 27%, so she was holding on to 70% of that 50 milligram iodine, which is about 35 milligrams. Her body was really deficient in it. And her excretion is about average for people that I see that are iodine deficient. I treated her with 50 milligrams of a combination of iodine and iodide, and within 3 weeks, all her symptoms improved. Within 2 months, she had no pain and normal breaths. She went back to her doctor, U of M, did an exam. He told her he felt like she had someone else's breasts on her body. He said, what are you doing? She told him. She told me that he had a blank look on his face, wasn't really interested in it, and just left, didn't ask any questions about it after that. But Iodine should be the treatment of choice with fibrocystic breasts. It's worked wonderfully in patients. In talking, there's only a couple doctors around the country doing this iodide therapy right now. In talking to them at a conference in San Francisco that I was at a couple weeks ago, they're seeing the same results I'm seeing with it. So what's the relationship with breast cancer? There is a relationship with breast cancer and hypothyroidism. It's been reported for over 100 years. It was first reported in 1896. There's really no consensus right now, but researchers feel there may be a link between thyroid problems and breast cancer. We know that hypothyroidism predisposes to a poor immune system functioning. We know hypothyroidism can alter other hormones, the adrenal, ovarian, and pituitary hormones. Other studies have shown an increased risk of breast cancer when one takes thyroid hormone. Now, I got to stop and have you think about that. I just said there's a relationship between an underactive thyroid and breast cancer, and in this slide, there are 2 studies reported in the conventional journals saying when somebody takes thyroid hormone, they have an increased risk of breast cancer. What could be the link between hypothyroidism, thyroid supplementation, and increased breast cancer risk? And it's iodine. Over the last 30 years, iodine levels have fallen over 50% in the United States. Breast cancer rates have risen dramatically. Thyroid illness from hypothyroidism, autoimmune, including Graves' and Hashimoto's, as well as thyroid cancer, has risen dramatically. And I feel the use of thyroid hormones in the presence of iodine deficiency can exacerbate an iodine-deficient condition. If you stop and think about it, you give thyroid hormone, which is supposed to rev that metabolism of the body. If they're already iodine deficient, you have the potential to make that iodine deficiency worse. And I think that's what's going on. And I've been interested in iodine for 10 years. I tried a little bit of the iodide, D-I-D-E form of iodine, and seeing minimal results. And I didn't give up with it. I just kept it on the back burner. I just didn't know what everyone's iodine status was. Once I started checking it and seeing this 95% low, that's when I started pulling the research. And the research is really clear with breast cancer and iodine, as well as thyroid problems. So iodine and breast cancer. The therapeutic use of iodine in treating breast cancer was first reported in 1896. There's a direct relationship between breast cancer and iodine deficiency. In Japan and Iceland, there's a higher intake of iodine and lower incidence of breast cancer. In the U.S., Mexico, and Thailand, there's a lower intake of iodine and higher incidence of breast cancer. Well, there may be other reasons why this breast cancer is increasing besides iodine. However, Poland, Switzerland, Australia, and Russia are found to have elevated rates of breast cancer associated with localized pockets of iodine deficiency. What that means is, in these countries, when they look at the soil levels, there's pockets of iodine deficiency, just like we're in a pocket of iodine deficiency. Those localized areas have much higher rates of breast cancer than other areas of the country. That gives a lot more credence to the idea that iodine might be related to breast cancer in women and prostate cancer in men. Same thing's going on with prostate cancer. But this pocket area has also been shown in the U.S. The Great Lakes Basin has the lowest iodine levels and the highest incidence of breast cancer. So the Japanese are a population with high iodine intake. The mainland Japanese, as I mentioned before, ingest 100 times the RDA for iodine, about 14 milligrams per day. Remember, in this country, the RDA is 150 micrograms per day. This is 100 times higher than we're ingesting here. Now, the coastal Japanese, the ones who live near the water, ingest significantly more. It's not known how much more. And much of their iodine comes from seaweed. What's the effect of ingesting over 100 times the RDA for iodine? They have lower rates of breast, endometrial, and ovarian cancers. I should have prostate cancer on there as well, since they have much lower rates of prostate cancer. And they have significantly lower rates of fibrocystic breast disease. Japanese women who move to the U.S., research has shown Japanese women who move to the U.S. have higher mortality rates of breast, endometrial, and ovarian cancer as compared to mainland Japanese. They have lower iodine levels could explain this observation. So what's the relationship between iodine deficiency and prostate cancer? Research isn't as complete. No one's really studied it, is the problem. And at the med school yesterday, the students asked me, well, why hasn't anyone studied this? You know, you seem pretty certain that that's the case. Well, iodine's not a patented substance. There's no money in it. And the other problem, well, I'll let that go. Mainland Japanese men have significantly lower prostate cancers compared to U.S. men. Japanese men that move to the U.S. have a higher rate of prostate cancers compared to mainland Japanese. Japanese men that move from Japan to the U.S. have significantly higher rates of prostate cancer as compared to U.S. men. In the second generation and third generation Japanese, their rates skyrocket compared to where they were on the mainland. And the common link to those has got to be iodine deficiency. Animal research has been, in Japan, they grow their crops in a seaweed. They use seaweed in a sludge as a fertilizer for their crops. So they get it more than just in seaweed. It's all over the place in Japan as a staple. So what's the relationship in animals? Animal research has been clear that in an iodine-deficient state, animal breast tissue will show signs of developing breast cancer. The researcher who's done the most work with iodine in animals is Bernard Eskin. And he has written numerous articles on this idea, and he cannot give animals breast cancer at any significant rate unless they're in an iodine-deficient environment. So if he's studying breast cancer, he must put them in an iodine-deficient state to study it. He writes that it thus appears that the maintenance of the optimum structure and function of the breast requires the presence of continuous and specific amounts of iodine. So how much iodine is taken up in the body? Thyroid takes up about 6 milligrams a day. Remember, the RDA is 150 micrograms per day. That is 50 times what the RDA is. The breasts take up 5 milligrams per day. Now that's for a 110-pound woman. A bigger woman needs more iodine. A bigger-breasted woman needs more amounts of iodine. Men have smaller breasts and lower iodine requirements. Maybe that's why